Hey, it's Andrew Pierce here. I'm here with fellow nurse Amari. Just gonna run down a couple questions here. Are you a nurse? Number one. Start off easy.
I am a registered nurse.
All right. You work in a clinical setting.
I work in a clinical setting.
Okay.
Or beach.
Hmm?
I heard a beat. Sorry.
It's okay. All right. So the project that I'm working on here is regarding our national patient safety goals. So the one that I've chosen here is improving our medication safety. So there's a few main elements of this. Um, One of the things that we're trying to do to improve our medication safety is improve our labeling process on all of our medications. A second point here is reducing the likelihood of harm associated with anticoagulant therapy. And then our next big point here is about medication reconciliation. Right, so we're working here in the ICU, so a lot of times our patients are coming directly out of the OR, so sometimes some of the medications that are hanging with our IV drips are kind of self-made by our anesthesiology team. So some of that, what's already hanging, may not match exactly what we have here, so a potential error could occur with not knowing the dose that's actually in our line. With our anticoagulant therapy here, sometimes our patients are on a heparin drip. Um, One of the things that's difficult to monitor with that is our PTT. So if somebody's got one or two IVs and say they are an amputee on the left side, trying to find an accurate PTT measurement is kind of difficult because anything that's in the venous return on that same side is going to kind of throw our numbers off a little bit. And then number three, which is pretty important to me, is our medication reconciliation. So if there are patients that can't talk to us very well, and family that may not know their history, it's kind of hard to figure out what medications they're on, what they're taking, what they're not taking, if what they're telling us matches what we have in our system, and how to go from there. So would you say you've come across any of those things or encountered those in the time you've been here?
Absolutely. I've even had patients that brought medications from home
Mm-hmm.
that they had with them that they didn't tell the nurse that they were actually taking.
Okay.
Um, that could be an issue too.
Okay. And another good thing that we could do there is kind of um, reach into, is there any herbal medication that you're taking? Because sometimes, even if that's not a prescribed drug, it could affect your prescribed drugs, and that could have something to do with the condition that we see. Um, okay, so when we're improving our medication safety, there's three bridge points that we want to look at, and that's what do we need to do with our patient? How does this affect our patient? What do we need to do, as nursing staff? And then on an organizational level, um, what changes do we need to make so that this, continues and is better in the future?
Absolutely.
So patients, um, the communication with medication reconciliation, number one, we can educate on the importance of that. We can build rapport to, find a way to get this information from them, and have open lines of communication. What else do you feel um, that we could potentially do to improve that from the patient side?
Education, just like you said, to piggyback, just explaining to them the importance of not only telling us as nurses about their medications, but the herbs or supplements that they may be taking.
Okay. And if we don't get this information, if we're not safe with our medications, how does that affect our patient? What could happen?
Overdose, interactions, or their medication's not working or working too well.
Okay. All right. So from a staff standpoint, um, we focused on our reconciliation, so improving our lines of communication as staff, being approachable, being understanding, um, being communicatively open to gain this information is good. Um, when we're working to make sure that all of our medications are labeled, so coming out of the OR, number one, they should be labeled as soon as they're made, but if they're not, one thing that we also need to do is communicate this is what this is. So even if, you know, something does slip through, we can still back check that. You say, this is how I've used this has been off for this amount of time, I need to remove this. Medications being labeled, another thing that I think is interesting is that in our patients here that have, say, like a triple lumen IV to the subclavian or IJ, a medication could be removed and the hub is not labeled with what was in it. So that can hold like a milliliter, milliliter and a half. If that's you know, a vasoactive drip and you don't do a blood drawback from that and you just push that in there, if that's got, you know, 1.5 ml of neosynephrine, you could potentially increase somebody's blood pressure really high, right? So another thing that we can do with our stuff that's not labeled is make sure that when we disconnect something, we get blood return back from that line and flush that line. That's something that has potential to greatly affect our patient safety, our medication safety.
And then appropriately label what was initially in it.
Right. Okay. So that works. Or you know, relay that all of these, you know, lumens are flushed, they're ready to go, you're safe to connect.
Yes.
You don't have to worry about that, because even if something's not vasoactive, if you connect a medication that's not compatible to an IV that hasn't been flushed, then you could potentially lose your access when you need it. You know, it's kind of more specific to our patient population, but as nursing staff in the ICU, that's something that I feel could definitely be relevant.
Absolutely.
Because small amounts of medications can make a huge difference.
And fast.
Yeah. And then on an organizational level, just to try to make this big, I think that trying to make sure what our hospital is doing or organization is doing is you know, matching what the Joint Commission is doing is an important first step. I'm sure that somewhere upper level management is aware of this, but trying to you know, potentially post these safety goals somewhere in our unit, or make sure upper level management is aware of them, is, you know, a great idea. Some of the nurses that we work with come from multiple different hospitals, and they've relayed to me that, you know, our EMR system is different here than it is other places. So trying to have some sort of continuity between our systems and what we're used to working with.
And staying up to date with our facilities protocols regarding those medications.
Yeah, that could definitely be helpful. Some systems, when you pull a controlled substance, it you know, automatically populates on your nurse brain, so you don't forget to make a scan or something like that, and that's not necessarily an error for us. But if it's not been documented that something's been given, and, you know, the next staff member comes in and then, you know, gives it because they don't think it was given, then we have a bad situation there. So even certain things that slip through the cracks that aren't absolute errors could facilitate errors in the future if, you know, our communication's not effective at shift change, and, you know, so on and so forth with that. Is there anything else you'd like to add that we could do to, you know, improve our medication safety, just off the rip?
I think you hit all points, but just to piggyback off of what you were last saying, like, you know, patient handoff is important. You know, tell your fellow nurse, you know, what you have done or what you haven't done. It's okay to say, hey, I forgot to do this, or I forgot to chart this, but I did give this.
Yeah.
You know, just so we can prevent patient demise,
Right.
or clinical errors.
That's you know, handoff is a time where a lot of things are happening in a very short period of time. So we can try to time manage better throughout the evening, so that is, you know, the number of tasks that may be having to occur in a 1 hour period are not as high, and that could give us the, you know, foresight to try to prevent errors that could potentially occur. But handoff and relaying necessary information is certainly very important to improving our patient safety, especially our safety surrounding medications, and reducing errors that come along with that.